The topic for today's lecture series will be clinical implementation challenges of next generation medical devices. This is your host for session 1, day 4, Asta Kapoor speaking. And on behalf of Department of Biotechnology and Medical Engineering, I would like to warmly welcome our first speaker of the day, Dr. Mirza Khalid Begg. Presently, Sir is an assistant professor in the Department of Biotechnology and Medical Engineering, NIT Rourkela. Dr. Begg did his bachelor's in electronics and communication engineering from KIIT University in 2010 and master's in analog and digital integrated circuit design, biomedical applications from the Center of Bio-Inspired Technology, Imperial College London in 2011. He did his PhD in bioelectronics for closed loop neuromodulation, and his postdoctoral work was on biosensors, bioelectronics. Sir's vast industrial experience includes new product development, embedded systems, engineer technology from January 2012 to May 2014, and bioelectronics I2Move project at Imperial College London from May 2014 to 2018. Dr. Begg's research interests include neuromodulation, electroceuticals, electroceuticals, and new methods to treat diseases through interventions on the nervous system, neurochemical sensors, application-specific integrated circuits for neural recording and stimulation, neuromorphic artificial intelligence and machine learning for medical devices and applications, AI and machine learning algorithms for personalized neuromodulation, vagus nerve stimulation, biosensors, electrochemical sensors, monitoring ionic and electrical activity on peripheral nerves. We are glad to have you with us, sir, today. I now invite you to kindly begin with the talk on the topic, electroceuticals, current scenarios and future directions. So,
Thank you, Asta, for the very nice introduction and a very warm good morning to all the listeners who are joining us today. Um, so, I was just while Asta was introducing, I felt the voice was dropping slightly. So I don't want to take the risk. So I will just turn off the video in case there are any internet issues. So we'll continue and then we'll continue with the talk. So actually, this workshop titled Next Generation Medical Devices, it was as conceived by Professor Iru Banot, myself, and Professor Bala Chakravarti. It's actually we wanted to look at upcoming interventions in the medical device industry, and also how these new medical devices, how as engineers we can contribute towards development of these new medical devices, and how we can integrate, kind of bring people from different disciplines such as engineers, clinicians, researchers together on a single platform, so that there can be better communication and better development of these devices. So with this in mind, actually, today's talk is on electroceuticals. It's an upcoming new modality of delivering therapy. So let's see what it is about. So I came across electroceuticals while doing my PhD, and I found it really, really interesting and intriguing. And I hope today's introduction to all of you, you will also be intrigued by it, and maybe it might stimulate some kind of interest within yourself, and you might want to explore the field yourself as well. So with this in mind, let's proceed. I don't know why the taskbar is not disappearing. Uh, so let me just try. Okay, now it's gone. Yeah, so what are electroceuticals? Essentially, we have for a long for many decades actually, we had these we know about therapies, and we know about techniques of treating neurological diseases by stimulating the nervous system. So one of the most popular, let's say, which has been around for quite some time, is deep brain stimulation. So with deep brain stimulation, people have been using deep brain stimulation, or DBS, for treating essential tremor, Parkinson's. Now, this term electroceuticals was actually coined or introduced by Chris Pham. So Chris Pham was previously, he was the VP of Bioelectronic Division in GSK, GlaxoSmithKline. As you know, it's a big pharma industry, pharma company. So in this article, he talked about electroceuticals and how we can use electronic pulses to deliver targeted therapy for specific diseases. Okay, so this was kind of the starting point, or let's say the point of discussion, or which ignited the interest all around the world uh, to encourage scientists to look into this new modality of treating diseases through stimulation of the nervous system. Now, why the nervous system is interesting to us? Primarily, there are two reasons. So first of all, nervous system, as you know, it is the control system of the body, and it innervates almost all organs in the body. So and it plays a very important role in many physiological processes, maintaining homeostasis in the body, and many other physiological processes it's involved in it. So the idea that, okay, can we talk to the nervous system, or can we interact with the nervous system in such a manner that we are able to treat diseases in a more targeted and efficient manner? Okay, so as we know that there's also another reason why we should look into new therapies. The main reason is its declining pharma productivity. So as you can see, in electronics, we have something called Moore's law, named after Gordon Moore, the founder of Intel, where we can see that as time progresses, the scale of electronic devices reduces, and reduces. Now, in pharmaceuticals, we have something called the E-Rooms law. It's just the reverse of Moore, where we see that the number of drugs per billion US dollar spending is declining. So we need to think about new therapies and new modalities of treating diseases, which are cost effective and which are more have higher therapeutic efficacy, and also which has lesser side effects. So first of all, why do we have actually side effects in traditional, let's say, pharmaceutical intervention techniques? The reason is it's the way we administer drugs. So let's say somebody is taking a pill. So this pill actually, so this pill, we take the pill and it goes, and the medicines and the molecules in the pill, they go into our bloodstream. It is absorbed in the stomach and it goes all over our body through the bloodstream. Now it's not only targeted to a specific location in the body, so it goes all over the body. Similarly, we sometimes might administer drugs intravenously, and that again, a way of pushing, drugs all over the system through the blood. It actually spreads throughout the body. So this actually leads to side effects in other areas. Compared to that, neural control, where in bioelectronic medicines or electroceuticals, we leverage on the nervous system, compared to like medications, where we leverage on molecular pathways for delivering drugs, or let's say in case of vaccines nowadays, because of the COVID, we are talking more about vaccines. So it leverages on the immune system of the body. Similarly, in bioelectronic medicine or electroceuticals, we tend to leverage on the nervous system to help help push the therapy to a targeted location in the body. And this is kind of an indication that the nervous system innervates most of the major organs, almost all organs, in the body. So it makes sense that if we are able to innovate, or let's say if we are able to target a specific organ and deliver therapy in a targeted manner, it is expected to have less side effects. In addition, as we will see later on, therapy can also be personalized. So the dosage, it can also be personalized. So in terms of, let's say, pharmaceuticals, for adults, there is a specific dose of, let's say, medicine, or for children, different dose, but all the adults are clubbed together in a way. But in bioelectronic medicine, we can further personalize also the stimulation dosage or therapeutic dose. So what is neuromodulation? Actually, bioelectronic medicine or electroceuticals, they leverage on or depend on neuromodulation. So neuromodulation is a technique through which we can, let's say, modulate or change the signals that are traveling along the neural highway, let's say, and we can change it. Either we can increase, or we can excite nerves, or we can inhibit nerves, or we can block the responses. So most of the neuromodulatory applications until now, or until let's say 10 years ago, a decade, it has mostly been focused on developing prosthetics. So for example, we have the cochlear implant. We also have the bionic arm. So these are prosthetics. Now, more and more research and more interest is being focused towards therapeutics. So can we use neuromodulation to deliver efficient, targeted, and personalized medication? So, and then again, there is so therapeutics can also be targeted towards two different areas. One is the central nervous system, which involves the brain or the spinal cord, and then we have the peripheral nervous system. So earlier on, for example, DBS, it is more targeted towards the central nervous system. Now, more interest is being devoted towards the peripheral nervous system for treating diseases such as diabetes, arthritis, rheumatoid arthritis, and many other diseases, which are not essentially treated as neural in nature, but maybe we can find out a neural pathway to treat these diseases. So this picture actually highlights what are the different potential targets for neuromodulatory interventions or electroceutical applications throughout the body. So this was actually highlighted by Tim Dennison. So Tim Dennison, I had the good fortune of attending a couple of his talks. He is one of the pioneers in this field. Originally, he worked for Medtronic. He was a VP there, and recently he joined Oxford University as a professor. So as you can see, some of the therapies are actually targeted towards the central nervous system, which is deep brain stimulators, have been around for a long time. Then cochlear implants, which is, of course, it's kind of a prosthetic as well, and then visual prosthesis for treating blindness. Then, of course, we have the responsive epilepsy stimulator for managing, or let's say suppressing seizure. And then we have, of course, there are other, you can also use neuromodulatory interventions to treat heart failure. And then we have, there are many other applications here, including, which is not shown here, but there's also vagus nerve stimulation, where we can use vagus nerves to control many parts in the, or treat many diseases, as we will see in today's talk. So when we talk about neuromodulation, there are actually the old, or let's say the traditional technique of neuromodulation was in a way open loop. So what do we mean by open loop? So when we talk about open loop, it means that there is the physician actually, after implantation of the electrodes inside the brain, what essentially what they used to do, there used to be a stimulator, which is like a pacemaker placed just below your clavicle, which is the and then um, this, in traditional open loop neuromodulation, the stimulation pulses or say electric pulses are delivered to the target location in a chronic fashion, in a regular fashion, with a fixed amount of dose. Now this frequency of stimulation and also the amplitude of stimulation is actually predetermined by the physician. Um, so essentially they keep on increasing the dosage until they see that the symptoms, let's say in this case, tremor, is ameliorated or has stopped. Okay, so I also had the good fortune of attending a conference which was organized by British Neuroscience Society. In that conference, actually, there was a patient who had a DBS implanted in him from a very young age. He was a rare case of Parkinson's, onset of Parkinson's from a very young age. I think about 10 years or 12 years old, he experienced symptoms of Parkinson's, and he had deep brain stimulation implant inside it. He was implanted with a DBS stimulator. And then, of course, he mentioned, he talked about his experience. He said that, yeah, it's working, and my life is much better with these kind of stimulators. So of course, these are we are not used to having or using implantable devices, but gradually as time progresses, as we progress into the future, it is expected that we will see more and more of these implants being used to treat diseases. Now, that is the traditional open loop kind of approach where the stimulation is delivered in a fixed manner for chronically for a long, like continuously. Now, it works, but at the same time, it may have some side effects due to overstimulation. And it also, from an engineering point of view, it's a drain on the battery, on the power supply that we are using inside the implant. So at some point, the patient has to have some kind of surgery to replace the battery or replace the implant, or in some way they have to. That used to happen a long time back, but nowadays they also have an inductive. They do wireless charging of the implant, so they have the charger which is outside the body. Through inductive coupling, you can also charge the implant as well, so that it keeps on working. So the patient experience actually in open loop stimulation is uh, is not that great. So can we improve the therapeutic efficacy? So also we have the neural plasticity, so that so it has been observed that the therapeutic efficacy decreases over time due to neural plasticity. Now, the question is, can we maintain neural plasticity? Can we improve the patient experience that by moving away from open loop stimulation to something which is more closer to biology? What is that? Now, when we talk more closer to biology, we say that can we stimulate only when we experience symptoms rather than just continuously stimulating. So that is known as responsive stimulation. So this stimulation is initiated when the tremor or the biomarker exceeds a specific threshold. So we can start stimulation. So in responsive stimulation, we are just answering when to stimulate. Okay, so we are not controlling the dosage of stimulation, but we are controlling the initiation of the stimulation. This is important to understand because ideally we want to control when to stimulate, such as in this responsive stimulation. We also would like to control how much to stimulate so that we do not overstimulate. And then the third question is how long to stimulate, like how long should we continue stimulating uh, or perform neural stimulation. Anyway, so these are some of the work which has been done at University of Florida, which they demonstrated that of course, they demonstrated the technology that they can do responsive dim brain stimulator for treatment of essential tremor. And also, they also demonstrated that the patient experience actually improves over time. Right. So as we said, in responsive stimulation, we are just controlling when to stimulate. Why do we need to control? So I also mentioned that we need to control how much to stimulate. Why that is important? A recent paper actually highlights why the stimulation dose is actually important. So as we know that brain, of course, the nervous system is acting like the control highway or control loop. If we consider the body as a control system, then the controller is actually the nervous system. So there are many feedback loops which control, let's say, the heart rate, parasympathetic and sympathetic nervous system, which control many different actually physiological aspects of the body. Now, coming down to why the stimulation dosage is important. So recently, um, a very interesting concept was demonstrated in this paper, which talks about a neural fulcrum. Okay, so what is this neural fulcrum? So essentially, we use vagus nerve stimulation as a neuromodulatory intervention for epilepsy. We use it as a neuromodulatory intervention. So for epilepsy, it is something which has been commercialized, and there are companies who are actually selling products or vagus nerve implants, VNS implants for treating epilepsy. Now, the vagus nerve again is one of the cranial nerves which innervates a lot of different organs, including the heart. So in this particular study, it was demonstrated so that when we do vagus nerve stimulation, it has been observed that it affects the heart rate. Either it increases or decreases depending on where you are delivering the stimulation. So there are two branches of the vagus nerve, so to say, as it comes out of the brain, the left and the right. And it has been observed that the right vagus nerve innervates the heart more compared to the left vagus nerve. So anyway, so even if you stimulate on the left vagus nerve, from my experimental experience also, um, the heart rate is actually changing, especially when you are doing high frequency stimulation, where you're blocking certain kind of nerve responses. That also affects, especially on the vagus nerve, that actually affects the heart rate also. So this particular study demonstrated that if you stimulate at a specific frequency, with a specific parameter, let's say intensity or current, stimulation current and stimulation frequency, then you observe almost no change in the heart rate. Okay, so and if you deviate from this fulcrum, from this point, then you start seeing changes in the heart rate. Okay, so these are different devices: Anthem, Nectar, and Innovate. So this actually demonstrates the importance of stimulation dose tuning, and it tells us that if we do not control, or let's say tune our stimulation dose, then it might lead to additional, let's say, side effects, which is also there in pharmaceutical interventions, and also it may also lead to reduced efficacy. So one of the reasons, actually, many of the electroceutical applications are still in kind of research phase, because the demonstrated therapeutical efficacy is not that high. So maybe closed loop neuromodulation, where we are effectively controlling when to stimulate, how much to stimulate, and how long to stimulate, can be an answer to improving the therapeutic efficacy of these neuromodulatory interventions. Then we will start to see, then we can see a full picture where we have targeted stimulation, very, very less side effects, and high therapeutic efficacy. So that is the effort that is going on around the world. People who are working in this area, they want to have better control on when to stimulate, how much to stimulate, and all these things. Anyway, just to give you an idea about what is the potential of neuromodulatory interventions. So this is again a study which was done by in collaboration with Galvani Bioelectronics. So essentially, I mentioned an article by Chris Pham from GSK. This now GSK and Google Life Sciences, which is called Verily, and now it is called Alphabet. So Verily and GSK came together, and they spun out a company called Galvani Bioelectronics, where they're exploring many different technologies, or let's say electroceutical applications. So here they are actually trying to use nerve blocking to treat, or to reverse insulin resistance. So they have done some animal study in rats, and the results are quite promising. And also, one thing I did not mention earlier on. So there are, like, for example, in pharmaceuticals, we have the agonist and antagonist. Similarly, in neuromodulation, we have the inhibition, which is and the excitation. So inhibition is where we try to block the nerve signals, neural signals, when we try to block the neural signals, and then excitation is when we try to excite the nerve by stimulating. So the manner of stimulation determines whether you are inhibiting, or let's say exciting the nerve, or increasing the activity of the nerve. This is one application. The other application is in mitigation of ventricular arrhythmia post myocardial infarction. Again, this is again an animal study. Um, Not so around 2017. The previous study was in 2018. So you see, these are not very far off, just 3-4 years back. And I have not compiled the recent studies. Maybe there are some new studies which may have come up. And then this is kind of more recent. Here, the previous applications that we saw, the previous studies that we saw, it deals mostly with inhibition, where we try to block the response on a specific nerve. Here, in this case, we are actually performing excitation or trying to increase the nerve signal or create more activity in the nerve due to stimulation. Here we are actually so in this study they are the target of intervention is the pancreatic nerve, and they say that okay, it inhibits recent onset of autoimmune diabetes. And as you can see, again, this study is also, it was also done in collaboration with Galvani Bioelectronics. So I had the good fortune of knowing or meeting actually Dr. Arun Sridhar. He's from he's leading. He's a biologist who works for Galvani Bioelectronics. Fantastic person and actually is doing great work. Anyway, so again, then there is another application where we are doing like in this particular study, they are doing vagus nerve stimulation, and they have shown that there are improved outcomes in stroke and rheumatoid arthritis. Now, the main question is, all these applications that have been shown here, they are promising and they show the potential of using or leveraging on the nervous system to treat many different diseases, especially as you can see, although like diabetes, rheumatoid arthritis, these are not traditionally classed as neurological diseases. But since the nervous system is intervening or innervating different organs, so we see that okay, there is a there is a neural pathway which can be used to treat or manage these diseases. Now coming to electroceuticals, these are targeted therapies, as we can see, because we are targeting specific organs in the body. But how efficient are they? It can be personalized also. Using closed loop neuromodulation, it can be personalized. The dosage can be tuned to the patient requirements. But how efficient? That's the bigger question. How efficient all these implants are. So here again, this is another example. So we are gradually moving. So initially, I have just demonstrated to all of you or shown to all of you some applications which from different let's the intervention target are for different nerves. Gradually, we are going into the vagus nerve stimulation area. Now, this vagus nerve is a multifunctional nerve, and we'll see that it has been used, or people are using it for treating many different diseases. So one of this is actually in this particular application. So we are going more towards the vagus nerve stimulation. The bigger always the question is how efficient. So here we see that we are using this company Setpoint Medical. Actually, they have come up with a very small implant for stimulating the vagus nerve, cervical vagus nerve, and they are using it to treat or reduce the inflammatory biomarkers in the body. And then again, this is kind of very one of the earliest vagus nerve stimulation devices or applications of electroceuticals, where people are actually using vagus nerve stimulation. They are stimulating the left vagus nerve. So as you can see here, left vagus nerve, using this implant called Aspire SR by Cyberonics. Now, Cyberonics has been recently bought by another company, Sorin, which is a European company, and they are using it to treat epilepsy. So we have electrodes which are actually latching on. These are called cuff electrodes, which are latching on the left vagus nerve, and the stimulation is delivered through a device the size of a pacemaker, and it's known as Aspire SR. Um, Now, okay, these are all, as we said, these are not yet, these are all open loop devices. So they are effective in some sense, but how effective it is, we need to evaluate. And always the switch, or let's say the motivation towards closed loop neuromodulation is to increase therapeutic efficiency, first of all. Then also, this is from a medical point of view or clinical point of view, that we need to improve the therapeutic efficacy of such devices. Second is we also need to improve the engineering outcomes, or let's say the engineering parameters. For example, we can, if it will be good if we can reduce the power consumption of the implant by doing stimulation in a controlled manner, and all, and in a very regular fashion, rather than doing it at regular intervals, we can tie it up with occurrence of symptoms. So now coming to something which is actually which I worked on during my PhD and postdoc. So vagus nerve stimulation, we have seen that it has been used for inflammation, for epilepsy, and now we come down to something very interesting, where we can use potentially use vagus nerve stimulation for treating obesity, so helping in weight loss. Okay, so these are different therapies that are present for people who are morbidly obese in a range of certain BMI. So what is the therapy that is recommended to them? So this actually this technique called V block is actually working on the gastric vagus nerve. The intervention target is on the gastric vagus nerve, and it's about blocking these the responses to the gastric vagus nerve and promoting weight loss. The idea is that the vagus nerve plays a very important role in conjunction with the gut hormones, various gut hormones, we'll see shortly. In conjunction with the various gut hormones, the vagus nerve plays an important role in controlling appetite, in controlling energy retention in the body, and all these applications. So V block is all about controlling the, or let's say modulating the vagus nerve signals, neural signals on the gastric vagus nerve to help in reduction of weight. Now, why do we need VNS? Why can't we use some other technique? So, of course, like the traditional weight loss technique has been diet and exercise, controlling your diet and exercising, so that you end up or spending more calories or than the intake. Okay, so it's very simple. So if your intake is more than the amount of calories that is being spent in terms of inactivity, then of course that leads to obesity. So this is the traditional approach. It works, especially if you are like gaining weight, or if you have in early stages. But once it goes to higher and higher BMI, it becomes less. It becomes difficult to exercise, and also it becomes difficult to lose weight. And one more actually downside, I would say, in terms of diet and exercise, is that we are all human beings. We have limitations. We are uh, tempted to eat good food and enjoy. So sometimes, okay, even if a person experiences weight loss, then there is a chance that, okay, if they are not able to control their diet and maintain their exercise regimen, then they will end up gaining weight anyway. So it's kind of, it works, but also for lower BMI, and it needs a lot of motivation. And then, okay, of course, there are also some obesity drugs. So these are anti-obesity drugs. So these are some medications which were being prescribed 2-3 years back. Maybe new medications have come up. Maybe they are more effective, but again, these are not without side effects. So yeah, so this is another way of intervening. And of course, the surgical intervention involves bariatric surgery. It is effective, as you can see in the pictures, but it's cost prohibitive. It's very expensive. For example, in Europe, it's about 30,000 euros per patient. And it's a big amount because some of the countries in Europe, they have national health services. For example, in UK, you have the NHS, which is the National Health Service, and it is paid by the government. Any surgical if a citizen of that country undergoes any medical procedure, it is generally paid by the government. So it's a big drain also on the public money. So, okay, bariatric surgery works, but of course it has morbidity and mortality associated with it. It has some risk associated with it, and also obesity is, let's say, a condition where it's not alone. So it has some other. It has impact on other biomarkers, for example, your heart rate, your diabetes. So with obesity, a person who is obese is highly likely to develop diabetes as well. So there are other complications associated with it. So it's not, first of all, the patients need to qualify for surgery. And even if they qualify for surgery, there are surgical risks associated with the surgery. So it's not a simple manner. So all these therapies actually for a researcher, for a scientist, it encourages you to think that is there a way to treat obesity in a minimally invasive manner? The answer to this is yes, and these are some solutions. So one of the solution which I have already shown you is this V-block implant by Intromedics. They are actually stimulating the anterior and posterior vagus nerve, and they have shown in their studies that it leads to weight loss. Maybe not as effective as you expected, but it does lead to weight loss. They actually conducted 2 clinical trials. Um, if you're interested, I can share it with you, the results and the paper. There's also this gastric balloon where actually they implant balloons inside the stomach. I don't know the clinical side of the clinical experience, whether how the patient feels with the balloon inside them, but it also promotes or lead to weight loss. And also there's another implant actually called the ability implant. So they are not stimulating the vagus nerve per se, but they are stimulating the gastric wall, the wall of the stomach. Now, when you're stimulating the wall of the stomach, it's highly likely that you are stimulating some afferent vagus nerve branches, which are present on the wall. So anyway, this is another kind of modality of stimulation. Now here, there is something important to note. This enteromedics implant is actually open loop. So it's not, it stimulates at regular intervals. It's not closed loop. Is responsive in nature. So whenever a person eats or a patient eats, then the stomach expands and the ability implant actually responds to this expansion of the stomach and initiates stimulation automatically. So here in this ability implant, the stimulation is actually tied to meal intake, and scientific evidence and clinical trial has shown that the ability implant is slightly more effective than the enteromedics implant. So this actually encourages us to think that will this lead to increased therapeutic efficacy if we administer vagus nerve stimulation or VNS dosage uh, in conjunction with meal intake. Now that actually brings us to a point where it will be good to understand what is the link between what is the role played by the vagus nerve in let's say food intake. So does it determine how much food we take? Does it determine what is the until when we feel? So we have this, all of us have this feeling that when we are eating, before eating, we are hungry. And once we have eaten, we feel full. So this feeling, when do we feel full? What is the role of vagus nerve in this? So vagus nerve plays a very, very important role in feelings of satiety, in feelings of hunger, and all that. So we have satiety signals and nutrient related signals which are traveling to the brain, and brain is the one which is actually determining when to this feeling of satiety and the feeling of hunger is actually originating from the brain. Now this is also known as a neurometabolic axis or the gut brain axis. Recently there has been a lot of studies in the gut where people are looking at the nervous system of the gut. People are looking at um, the gut bacteria and the role the gut bacteria plays in many different diseases. But of course, yeah, it is true that there is a very strong control axis, which is complex as well, called the gut-brain axis or the brain-gut axis, whatever you call it. It's also called as the neurometabolic axis. And this neurometabolic axis plays an important role in obesity or in determining when a person stops eating and how much energy they retain and all that. And the way it works is essentially vagus nerve is the pathway to the brain. So very important. So here it involves the endocrine system, and also there are certain hormones, which is the PYY and ghrelin and leptin and insulin, CCK. These are all gut hormones. these gut hormones interact with the vagus nerve afferents. So afferents are those nerve branches which carry signal from the different parts of the body to the brain, and the opposite of afferents is efferents. So essentially, which carry signals from the brain to the different parts of the body. So these gut hormones, they interact with the afferent nerve endings of the vagus nerve, and signals are sent through the vagus nerve to the brain, and then the brain determines when and how much to stop. So there was a study which I have not included here, but actually it will give you, I should have done it. It actually gives us an idea that what leads to obesity. So there was a study which was performed in dogs where it shows that with increased fat intake over a sustained period of time, uh, the sensitivity of the nerve endings, afferent nerve endings of the vagus nerve reduces, which kind of gives an indication that if we are not careful about our diet, then gradually and gradually it actually leads to lesser sensitivity of the nerve endings, and it leads to obesity. It will lead to longer, let's say, meal time and greater intake of calories, and it leads to obesity. Okay, so this just a simple kind of insight from a study which is useful in understanding the different aspects of this entire neurometabolic axis. So here actually there are two methods how we can interact with the, or let's say intervene with the neurometabolic gut axis, gut brain axis or neurometabolic axis to treat obesity. One is, can we, through excitation, can we um, increase the sensitivity of the afferent nerve endings? This is one. The other thing is, can we do nerve blocking, which actually so that a patient feels full early on. So when we talk about excitation, then we generally have low frequency stimulation, neural stimulation. And when we talk about blocking the neural responses, then we generally people tend to use high frequency neural stimulation. Okay, so these are some more. So I had the good fortune of working with Professor Steve Bloom. He was one of the earlier pioneers who discovered some of these hormones, the role of these hormones, gut hormones. But yeah, so just it just explains how important these gut hormones are in terms of controlling satiety, in terms of controlling the energy, how much energy we retain in our body, and all those things. Now, coming to this VNS application, so we have some prior work, which is the V-block implant, which stimulates in an open loop fashion. And then we have the ability implant, which kind of stimulates in a responsive fashion, which is which is tied up with meal intake times. Now, this is a typical closed loop system. So typical closed loop system is not only limited to neuromodulation, neuromodulatory applications, it can be expanded to other diseases such as diabetes. Now, in a typical closed loop system, you have the neuromodulatory target from where you are monitoring certain biomarkers. So these biomarkers are picked up by a sensor. It can be a chemical sensor, or it can be simply an electrode which picking up electronic signals. So we have signals which are coming from the sensors. Then, of course, we have some kind of chip or some kind of electronics which does data acquisition, then processing, and after the output of a processor is basically answering two questions: when to stimulate and how much to stimulate. I mentioned how long to stimulate, but essentially that how long to stimulate questions actually comes under how much to stimulate. So when we talk about when to stimulate, we say when should we initiate the stimulation. For example, in the ability implant, they were initiating the stimulation with meal intake. So that is answering when to stimulate. Now, coming to how much to stimulate. So when we talk about how much to stimulate, we have to think about what should be the stimulation current, what should be the stimulation pulse width uh, of the current waveform, and what should be the frequency of stimulation, how frequently we should stimulate, whether we should do low frequency stimulation or high frequency stimulation. And finally, how long to stimulate? How long should we continue stimulating? Okay, these are few questions that is answered by the processor. So in a way, we are mimicking the nervous system, or let's say the control axis in the brain or in the body using engineering. So this actually, as we said, there is some prior work which is open loop. One solution is open loop stimulation, neurostimulation. The other one is responsive neuromodulation. So these are not complete. So one of them is completely open loop. The other one is partially closed loop. It is answering only when to stimulate. So this actually got us thinking, can we answer the question when and how much to stimulate? So this actually led to this work, this research work, which I did during my PhD, which is actually, it consists of this electrode, a cuff electrode, which has some microspike array on it. So cuff electrode wraps around the nerve. So there is some microspike array, and then there are some electrodes which are wrapping around the nerve for stimulating the nerve. These are stimulation cuff electrodes for initiating nerve stimulation. And these are microspike arrays for monitoring chemical reactions. So why do we need to monitor chemical reactions inside the nerve? Or chemical biomarkers or ions inside the nerve, we will see shortly. But essentially, we came up with a solution where we thought we can use two different modalities, the electrical and chemical sensing modalities, to answer when and how much to stimulate. So these are some vagus nerve biomarkers. So these are traditional, like if you put a cuff electrode on a vagus nerve and you record, so this recording was done on a rat nerve, and you record the natural neural activity, which we call mass activity, vagal mass activity on subdiaphragmatic vagus nerve of a rat. Um, so here we see that, first of all, the amplitude is very less. So it's about 10 microvolts. So here, if you see in a much more like zoomed in with the scale, and you see that the maximum we see is about 10 microvolt signal. Now, this is again very small from an electronics point of view, because the input referred noise of many amplifiers are around that range. So we have to have a really low noise amplifier to pick up these signals. Again, when we design low noise amplifier, those of you who are from an electronic background, electronics engineering background, you will know that as we improve the noise performance, the power consumption shoots up. So then there is some kind of trade-off that you have to address. In addition, that is not enough. The amplitude is not the only problem. Now, vagus nerve is a multifunctional nerve which actually innervates many different parts of the body, as we mentioned, and we see artifacts on the vagus nerve, which you might think, okay, it is from the gut, or it is from, but it's actually some kind of breathing and heart rate artifacts. So these are some breathing and heart rate artifacts which we observe. So this actually got us thinking, can we have an alternative to traditional electronic signaling or electronic biomarker, like neural signals, neural mass activity? So can we monitor the ions, which are actually the cause behind this neural electrical activity? So we have different modalities. We can use potentiometry or voltammetry. So so this is, it's not new. Neurochemical sensing has been done in the brain, not in the nerves, in the brain, where people are using cyclic voltammetry to actually monitor dopamine in the brain. It's a neurotransmitter. People have also demonstrated neurochemical sensing in vagus nerve uh, in 92, 86 early on, but using a glass electrode, glass pH electrode, which is a standard, which is the gold standard, you can say, of pH recording, potentiometric measurement. Now, this is obviously not implantable. So what is the reason? What is the how does pH change due to neural activity? So this is some of the origin of where what is the cause of. So as the ion channels open up and there is an exchange of ions, it leads to extracellular acidification or alkalization, and it leads to pH change. Now, okay, so we know that, okay, maybe we can leverage on chemical sensing. um, of course, we have the problem of electrode. We cannot use the glass electrode, which is not implantable. So what we can do So can we develop a solution which is or electrode which is very small and it can be used on a very small kind of small dimension nerve. Let's say in the rat vagus nerve, it's around 200 microns thickness. So which is about the human hair size of human hair. You can say the thickness of the human hair. So how do we innovate? We cannot. Can we use an implantable electrode which will sit on this nerve, small dimension nerve, and record signals? So chemical recording from in vivo vagus nerve has never been done before. So we attempted it using the iridium oxide electrode. So iridium oxide actually you can use iridium oxide you can use for monitoring pH. So as you can see here, it also offers the advantage of invasiveness and high sensitivity. So and one more thing I want to bring to your notice. So there are actually you can fabricate very small dimension electrodes. For example, in this Utah array. So Utah array is traditionally used for recording signals of the cortex. So you're performing electrocorticogram ECOG signals. Similarly, they are actually coated with iridium oxide. It helps in increasing the charge density. So these iridium oxide sensor can be used to monitor pH. So with this in mind, we performed some experiments. Was done during my PhD at Imperial College. So on rat vagus nerve, this is our experimental setup. So for in vivo sensing, we tried essentially we are actually only recording. So this is a hook electrode, pH electrode, which has been functionalized with iridium oxide, and it's inserted into the nerve. And these are some results. So these are some challenges. So when we try to record from the rat vagus nerve, of course you see, and this is a potentiometric way of measurement. You see drift and other signals. You see background activity. Then the challenge becomes how to remove this drift, how to identify activity which is specific to CCK. So we were targeting a gut hormone known as CCK and cholecystokinin, which is released in response of when we eat food and the food breaks down, and in terms of when the nutrients are released and absorbed into the gastric system, then CCK is released, and this CCK goes and interacts with the vagal nerve afferents, and it sends the signals to the brain. So essentially, these are some pH changes that we observed during our experiments, where we injected different dosage of CCK. So this is saline only, and then 50 picomole of CCK, 1000 picomole of CCK. So with saline, we do not get a response, but with 1000 picomole, we get a nice response. And then there is some kind of dose response also you can see. So as we increase the dosage of CCK, the pH magnitude of pH change increases. So this gave us some encouraging results. And we can think that, okay, hypothetically, if let's say an electrode is implanted into the vagus nerve, then whenever, let's say, a person eats, CCK is released, then we might see some changes in the pH. And then if we build the algorithms to actually identify CCK specific patterns in the signal, then we can use it to initiate stimulation. So this actually led us to develop an adaptive or kind of responsive stimulation, where you can initiate the stimulation without and just relying on the pH. And we did some initial experiments with this. So where you can see that whenever the CCK is injected, and we are able to detect this change due to CCK and initiate stimulation. So these are just stimulation artifacts. So pH change due to stimulation. So these are not changes. So yeah, so that's all. Now, so we managed to answer in some way, some fashion, how to when to stimulate. So tying up CCK with neurochemical response like pH, and then initiating stimulation. So this is kind of answering when to stimulate. Now we have the bigger question: how much to stimulate? So how much to stimulate? Actually, we can use this compound nerve action potential. So these are elicited when you stimulate a nerve using cuff electrodes. So these are called as compound because all the nerve fibers, they fire up due to this stimulation, and when they fire up, the sum of this the sum total of these responses you can observe on the cuff electrode. So this is the stimulation artifact, and then you see the neural response, corresponding neural response. So we also did some studies that if let's say if we inject CCK, what happens to the sensitivity in presence of CCK. So it indicated, so before we go into that study, let me just elaborate. So in the vagus nerve, gastric branch of the vagus nerve, we observed that there are actually A delta fibers, which are the fastest. If you stimulate, we were stimulating at the cervical region, left cervical, and then recording in the gastric branch of the vagus nerve, which is about maybe 8 centimeter away in a rat. It will be much more in humans. So there we got a nice segmentation of different fibers, because different fibers have different fiber velocity. So A delta, B, C1, C2, and C3. So you can group the fibers together in terms of their fiber velocity. Now, there are also certain artifacts. So we use two different channels, vagus and reference channel. So we use the reference channel to pick up, let's say, EMG activity, which shares the similar bandwidth as the compound nerve action potentials. And when you see a signal which is common in both the vagus channel and the reference channel, you can remove it as an artifact. So the red one, if you can see clearly, then that is the reference channel, whereas the black one is the vagus channel. Um, so with this one, we were able to stimulate. So essentially, we were able to characterize the vagus nerve, where we were able to understand what sort of stimulation current and what sort of stimulation pulse width uh, and leads to what response, what is the response. So in using that information, we can actually develop an algorithm or some technique to tune the stimulation dose. So now we are close to answering how much to stimulate. So we answered when to stimulate using chemical signaling, and we answered how much to stimulate using compound nerve action potential, which is kind of electrical signaling. So it's kind of it's a type of bimodal recording where you use chemical signaling to answer when and how much to stimulate. So these are some results. Also, we also found that there is some change in sensitivity of the nerve endings A and B fibers when CCK is present in the system. So this ties up with previous work in which people have done fiber dissection, injected CCK into the body, into the rat, and then tried to measure and see the neural mass activity. Through the neural mass activity, they were able to show that yeah, CCK is selectively affecting A and B fibers. It's actually inhibiting, or let's say reducing the activity of A and B fibers, and increases the activity of C fibers. So in compound nerve action potentials, we only saw that we were able to observe the inhibition of A and B fibers. Now that the previous result was with neural mass activity, we got this with the compound nerve action potentials with some statistical significance. Anyway, so this is actually, it's almost time to conclude my talk. So I'm just bringing it down, maybe moving a little bit fast. So now to summarize everything, uh, we actually developed a dual mode closed loop neuromodulation system where we leverage on the chemical signaling to actually answer when to stimulate, which is the stimulation trigger loop. So we have two different control loops, and then we have the stimulation dose tuning loop, which answers how much to stimulate. And before we do that, in order to personalize the system, we do this initial stimulation. We provide a range of stimulation parameters, and we are able to characterize the nerve, so to say, and we can personalize it to some extent. This personalization is important because, okay, nerve velocities don't vary from person to person, but the way we implant the electrodes, the interface between the electrode and the nerve will change from person to person because it depends on implantation. This is something which Professor Sanjeev Sharma also highlighted yesterday when he talked about microneedles for sensing from interstitial fluid, glucose sensing from interstitial fluid. So the change in impedance we can personalize for the change in impedance using this stimulation protocol, which we saw earlier. So in our work, we have mainly focused on stimulation current and stimulation pulse width. without going into the frequency. So we used a traditional low frequency 2 hertz signaling. So these are some, this is a more detailed block diagram, functional block diagram of our system, where we are using two different control loops, 2 and 3, and one is used for initial stimulation parameters, and then we use it to answer both when to stimulate and how much to stimulate. So these are some electronic techniques, which we signal processing techniques, which we used for removing drift in the chemical signals and identifying signals which are actually specific to CCK rather than and removing the background activity. So I'll just go through the results. And finally, we have the closed loop neuromodulation system, where we are identifying, we are using the electronic control nerve action potentials to determine how much to stimulate. And we are able to use some processing pattern recognition systems techniques to actually identify activity which is specific to CCK and remove the background activity. I've done nerve character. The whole process involves nerve characterization first, then it involves detection of CCK, and then stimulation based on the stimulation parameters. Now, all this is nice, and it sounds very maybe it sounds nice in terms of concepts and in terms of experiments. As engineers, we work in the applied domain, and we have to think how these technologies can be brought to market. So these are certain factors that we need to consider when developing technology. Whether we all a closed loop electroceutical technology may be very good, but if you are not able to justify the economic viability, it becomes difficult for any company to sustain to develop a sustained product. So there are two aspects. One is the healthcare economics and the functional restoration, which is this is more of the clinical side, and this is more of the economics part of the picture. So we have to balance both. And how do we balance? We balance that using a parameter called QALY, so quality of adjusted life year. So essentially, so QALY is telling us on the y-axis we have health-related quality of time, quality of life. So whether the quality of life is improving or not with intervention, and then we have, if we have improved quality of life, then how long a person, like the morbidity in terms of when the death occurs, are we able to prolong the life of the person. So through this, we can get an estimate of what will be our QALY. And in the UK, so this picture actually was by Professor Tim Denison. In one of his talks, he talked about this. So he said that, okay, in the UK, the typical QALY is 25,000. So I mean, it varies from country to country. So it depends. Maybe for India, it may be a different figure. But these are some translational challenges that we need to keep in mind when developing solutions for electroceuticals. And in general, so this QALY is also applicable not only to electroceuticals, but also to other therapeutic medical device technologies. So in terms of future considerations, we need to have a much better understanding of neurological networks, so that we increase the therapeutic efficacy. And also now today, although there's a lot of work is being done in this area, but there is still a lack of clinical data, shareable clinical data, let's say, where if, let's say, somebody else is doing research in some other part of the world, it's difficult to share the clinical data without like satisfying. So that needs to be there. And also, finally, we need to engage the patients, because they are the ones who will be receiving the care at some point. So patient acceptance and involvement is also very important. And finally, and most important, is the ethical concerns and regulatory challenges that we have to address. To thank Professor Irubanot for giving me this opportunity to talk, and also thank some of my collaborators and my previous employers and where I worked with, and some funding agencies. So that's all, I think. So over to you, Professor Irubanot. Thank you very much for the talk, and hope you all enjoyed it. Any questions? I'm happy to take.
Thank you, sir, for wonderful talk. Okay, so thank you for your insightful, it's a great talk. Okay. So now floor is open for questions. If you have any questions to ask Professor Khalid, so please feel free to ask if you have any questions.
Sir, this is Pragya. I have a question. Uh, the stimulation you talk about, so
Yes.
it will stimulate 24-hour if you put the device inside your body. So I wanted to know about the timing of the stimulation. It will some means how it works.
Yeah, sure. Actually, stimulation, if we talk about open loop neuromodulation, so the stimulation is performed at regular intervals and 24 over a period of 24 hours continuously. Let's say the physician might set it, let's say every 1 hour, one stimulation pulse is given or stimulation dose is given. So in this way, in open loop stimulation. Now, when we talk about, as we discussed, this is actually it has some side effects, and it's not like from an engineering point of view also this is not effective, but it does the job. It has some therapeutic efficacy. Now this is open loop stimulation where we stimulate at regular intervals at with a fixed amount of dosage. Now when we in closed loop neuromodulation, the idea is that we stimulate only when the patient experiences the symptoms. For example, in terms of Parkinson's or essential tremor, people experience symptoms when they are doing a specific task. Let's say when they are raising their hands or bringing their hands together or raising their hands, they feel the tremor occurring. Now here, instead of stimulating it over regular intervals or in a chronic fashion, whenever the patient experiences tremor, the device will start stimulating. So this is a closed loop approach. I will give you another example. For example, in I discussed this Cyberonics implant where they were stimulating the left vagus nerve. Um, so instead of stimulating regularly at, let's say, regular intervals, 1 hour intervals or 2 hour, whatever, over 24 hours, it will only stimulate when it detects that there is a seizure that is going to happen. Is that clear?
Yes, sir. Sir, another one, at the nerves end, because our nerves end at foot. These days, the acupuncture, acupressure, and the patch on the foot, these things are generally used mostly by the China, Thailand, and those countries, and abroad also.
Yes.
So this electronic stimulator, if it can be planted on the foot, so
Yeah,
it will
actually, it
be
is. Yes, you are
cost
right.
effective and
Actually, it depends. You are right. So there are some already there in market. There are some solutions which actually do some transcutaneous stimulation. Transcutaneous stimulation means stimulation when like it will be like a patch electrode which is put on the foot, or it is put on let's say back pain. For treating chronic back pain, people have experimented with transcutaneous stimulation. So it is like a patch which is on the skin, and then it is done and the stimulation is delivered. But the risk is this transcutaneous stimulation, it is not very targeted or specific. So as you know, it actually creates an electric field, and this electric field affects the nerve which is sitting below the skin. Okay, so yeah, to answer your question, there are some you can Google also transcutaneous stimulation or TENS. They call it TENS, transcutaneous electronic neural stimulation TENS. These are some products which are already there in the market which do it either for back pain or like addressing pain in specific, let's say foot, as you mentioned, or muscles. Yeah.
thank you so much, sir.
Thank you.
Hello, am I audible?
Yes, yes. Please go ahead.
You this interesting examples of this vagus nerve stimulation, treating obesity as well as reversing insulin resistance. So these are all by invasive stimulation, right? Is there any non-invasive?
Invasive. Yeah,
Maybe?
so actually, yes. So there is actually some, there was some initial studies. Actually, people experimented. There was one, I remember, there was one company in Germany, actually, when I was doing my PhD. We have the vagus nerve. Also, there is a branch of the vagus nerve in the ear. They call it auricular vagus nerve. I don't remember the exact name, but they develop like a stimulation. And as you know, the skin in the ear is very thin. We can sometimes see the capillaries as well. So there they implanted like they made like a earphone kind of structure, which they would put inside the ear, and you can stimulate externally with a handheld device. So they said that, okay, they were trying to explore this non-invasive vagus nerve stimulation on the auricular branch to treat depression and this kind of diseases. Specifically for obesity, I have not come across any non-invasive stimulation methods or vagus nerve stimulation methods for obesity.
So for this obesity, this invasive stimulation techniques, how do you evaluate it? Are you measuring this neurotransmitters, and then how do
Yes.
you...
No, actually, as we said, so first of all, the idea of using this invasive stimulation, first of all, we need to think how we implant it. So people try to what they do, surgeons try to implant some of these electrodes using this laparoscopic techniques into the gut, first of all. Then in terms of evaluation, how they act, maybe your question is about how they, what is the therapeutic effect of this stimulation?
Yeah.
The answer, that's correct, right? That is your question, right?
Yeah, that's right.
Yeah. So the answer is these kind of, let's say, vagus nerve stimulation, which are dealing with the gastric branch, they actually they try to either block the A. So we have the vagus nerve, and inside the vagus nerve, you have different types of nerve fibers like A, B, and C. So A and B fibers, mostly they are efferent fibers, which carry responses from the brain to the gut. And then C fibers are mostly those fibers which carry, they are called as afferent, which carry responses from the gut to the brain. So when you put a cuff electrode around the vagus nerve, people have tried two different methodologies. One is they do high frequency stimulation to block the responses in the nerve. So their argument is that we are blocking the hunger signals. And because we are blocking the hunger signals, the hunger, like the nerve signals, these are electronic signals on the nerve, action potentials, we are blocking it, the patient will feel full. So this is one modality. The other modality is people are actually doing low. So this is high frequency electronic stimulation. Then people do low frequency electronic stimulation. And the argument for this is that, as I mentioned in the talk, that obesity results may be due to decreased sensitivity of the C fibers. So when you do low frequency stimulation, essentially they elicit neural responses on the C fibers. Although when you stimulate using a cuff electrode, you elicit neural responses or in all the fibers. But their motivation is that we are increasing the sensitivity of the nerve endings in the C fibers. Hence, actually, we are, let's say, satiety signals, which should have gone after a longer duration of time. Because we have increased the sensitivity, these satiety signals are going to the brain at an earlier, let's say, earlier time. So hence the person will feel full in at an earlier time, and they will stop eating. So that is the kind of idea. So either to increase the sensitivity by doing low frequency stimulation, or to reduce the sensitivity by doing high frequency stimulation. So sorry, to block the nerves during high frequency stimulation. This is the modality. We do not know it actually, because in terms of neurotransmitters, there could be an effect in neurotransmitters also, because the vagus nerve is emerging from the brain, directly from the brain. So it's a cranial nerve. So when you are stimulating, that response can trigger some kind of neurotransmitter release in the brain. We do not know. Of course, I mean, this feelings, it's a very complex actually system, and we do not fully understand the entire system. So this gut brain axis, you see, you may have also observed that when you feel happy, you tend to eat more. Your mood is better, you like to eat more. And when you are sad, maybe you have not done well in your exam, or maybe you for some reason, if you are sad, then you tend to eat less. You see, there is also an impact of mood also on satiety signaling. So definitely there is a complex mixture of neurotransmitter signaling in the brain, gut-brain axis. So it's not a single factor which is acting. It's a multifactorial problem, or let's say multifactorial effect is there.
Yeah, it's absolutely
Yeah.
true.
So in terms of yeah.
So when
Yeah.
you're stimulating the vagus nerve, does it affect other organs, or this kind of complex mechanisms will be triggered?
Yeah, actually, I will tell you one interesting anecdote. So I came across a paper. You know how people started looking into vagus nerve stimulation for obesity. It actually started, people, as I mentioned, one of the earliest VNS therapies was for treating epilepsy. Now they implanted it in a clinical trial. They implanted it in patients. Now they observed that people who actually were implanted with this vagus. So of course, in a clinical trial, you have sham or placebo, where the device is implanted, but no stimulation takes place. And then you have, let's say, intervention group where the device is implanted and you also have some, stimulation happening. They observed that in addition to reduction in the occurrence of seizure, they observed weight loss in the patient, like in the intervention group. They also observed increase or better mood. So that's how, the therapy, the people started looking into from epilepsy, from a clinical trial in that was conducted to study epilepsy. People started looking into using VNS for helping in reducing weight or losing weight, and also in treating depression. So yeah, it has multiple effects. When you stimulate with the vagus nerve, it has multiple effects. Not only that, when you're stimulating as well, on the left vagus nerve, as I showed in one of these papers called the neural Fulcrum paper, it definitely affects your heart rate. So if you do high frequency stimulation, your heart rate goes down. So there is also, you have to tune the stimulation dose in such a manner that it doesn't affect your heart rate, especially if you're stimulating in the left or right cervical vagus nerve.
Because this is part of the autonomous nervous system, no? So it
Yeah,
can have
yeah.
effect everywhere. So this
That is
very
true.
interesting session. I'm
Thank
Mini
you.
from Department of Biomedical Engineering, Model Engineering College, Kochi, and
Good to have you.
interesting. Thank you so much.
Thank you. Thank you. Any more questions?
Hello.
Yes.
Vibha,
Yes.
thank you for informative session.
Sorry, your voice is dropping. Can you repeat your question?
In introductory slides, you mentioned about spinal cord implant.
Sorry.
About the spinal cord implant, which where we use the responsive modulation.
Not the spinal cord, deep brain stimulation. I don't think I mentioned the spinal cord implant. I can show you which slide you are maybe asking. This one, right? Is it this slide?
Previous one, sixth number.
This one.
Yeah.
Yeah. This one you are talking about, spinal cord. Yeah.
Spinal cord.
Yes.
Which used for the avoiding
Chronic pain.
Pain. Yes.
Yeah.
Then what it means, like what kind of
how it is doing, how is it working? Is that your question, right?
Yes, that is.
Yeah, so I will tell you, there is actually a company in Australia. They had a recent study done. Actually, they came up with a spinal cord nerve stimulator device, where I will tell you how it's working. So essentially, when, let's say, when do we experience back pain? You think about it. So chronic back pain happens when a person is bending, or maybe they are sitting in a specific posture. So their responsive stimulation implant actually, I don't know why that the name of the company is actually, it's called Sensionics, perhaps. I'm not sure. But essentially, there is a company in Australia which does responsive stimulation for treating chronic pain, especially back pain. So I will explain the way it does. So when a person bends, they are monitoring the neural signal. The neural mass activity increases. And then when they see there is an increase in mass activity, neural mass activity in the spinal cord, they initiate stimulation to block these pain signals. So these are pain signals which are causing increase in neural activity, and they do high frequency stimulation to block it.
So like our group is also working on the lower back pain mainly due to the damage in the IVD part. Because of the damage in the IVD part, the nerve in the spinal cord is pushing somewhat the components in the IVD is pushing the nerve, and it creates the pain in the lower
Yeah.
back. So is this electrostimulation will help to reduce the lower back pain?
So yeah, it does help. It helps in. So I'm just trying to actually, if you drop your email with Professor Iru Banot or even in the chat box here, then I will respond back to you with a paper where they have demonstrated these results of a very recent clinical trial paper where they are actually doing spinal cord stimulation (SCS).
Do we have any more questions for sir, please?
I guess that's all. I guess, Asta. So I think we can maybe conclude.
Yeah. Okay. Thank you, sir, for delivering a very informative and interactive lecture. We all are immensely grateful to you for providing us with the insights which
Thank you.
intrigued, inspired us, and added to our knowledge.